This is a first dental visit. 3-year-old, this is not my patient, so there's only a couple of slides on my patient, but this is a 3-year-old boy, came in for his first dental visit. One of his teeth is infected, has an abscess, his face is swollen. I don't know if you can see, if you put half here of his face, you see how right here it's swollen? That's his first time to a dentist, and this is what we have to deal with. So when do you go to a dentist for a first visit? If this at 3, which incidentally, if you go to your general dentist or your pediatrician, they'll tell you to go for a first dental visit at the age of 3. But do you want to go when this is what's going on, or do you want to go earlier? I would think you want to go earlier. Okay. American Academy of Pediatric Dentistry recommends the first dental visit by the age of 1 year or within 6 months of when your baby's tooth first erupts, whichever comes first. So we're talking for a first visit to the dentist at the age of about 6 months to a year. And, you know, people are like, well, they hardly have teeth, they've got 2 teeth, what are you going to do? What I'm going to do is educate the parent. I'm going to educate them about brushing, flossing, and teaching them what causes this damage so that we don't see that when they're 3, them coming into my office with a face swollen. And that's what's really essential. And also, you know, it's like, oh, my child has a pediatrician visit today. Nobody else like, well, is your child sick? No. It's like you go for a well baby visit, and it's pretty much the essentially same thing. You know, it's a well baby dental visit. Okay. So I mentioned this, you know, pediatric dentists, especially trained, may feel more comfortable examining young children than a general dentist. I mean, it's not just to market me, a pediatric dentist, but a case came up last week in my office. A kiddo came in, this was about Tuesday, and the mom called me and she said, oh, my child's filling broke, and that filling's been done by a general dentist 3 times already, so can you just take a look at it? I said, okay, you know, it's just a filling, right? No big deal. And the mom tells me that the child has been seen by the general dentist religiously every 6 months from the age of 2.5. So I'm thinking things should be fine. If a dentist is evaluating this child every 6 months, since the child's 2.5, what should I see in this child's mouth? Okay, a broken filling. Maybe the dentist did a filling, couldn't do it right. It's okay. These things happen. Then the mom tells me, well, look at the other filling too, because that's been falling off quite a bit. Just take a look at it. So I wish I had pictures of that child because I had some major camera problems this weekend. But to make a long story short, that child came in my office, had 2 bilateral abscesses, and I'll show you a picture of it, where the pus was coming out of the tooth, and the top 4 teeth had big decay, and we had to end up putting silver caps on all 4 of those top teeth. And this is a child who's been seen by a general dentist every 6 months. So it's something to evaluate. I mean, I know, general dentists are good at what they do, but sometimes you do want to evaluate with a pediatric dentist because we are not afraid to go in and put a cap on a tooth. The general dentist will say, well, let's not do it. The reason let's not do it is because they can't do it. They're not able to do it. They're not trained as well to do it. So what do we do in a first baby visit? I don't remember how old this kiddo was. I think he was about 1.5 or 2. So this is what we do. This is the mom. The legs go, under the mama, around the mom. So you see the mom's holding the child's hands, so these hands can come up here and affect what we're doing. And this is me. I'm actually cleaning his teeth right now, and I've got control. His head is in my lap, and I'm actually cleaning the teeth, and the mom's right there looking at the child. The child can look. So this is what we do as a lap-to-lap visit for the babies. What are we looking for? I don't know if everyone can see this, but right here, you see on the silver thing is a little bit, that's plaque. And it builds right along that gum line, which is where the pink and the white meet. Right there is where, if you scrape right here, you'll see that. It's an invisible film that is noticeable when scraped off the teeth. Plaque is pretty much the color of teeth, so you don't know it's there, but that's what you're really looking for. Okay, so I'm almost coming to the end of this lecture. It's going to be a lot of pictures, but when plaque is left on teeth for a long time, again, our favorite word, time, white or chalky areas develop. So I don't know if you can see, like, white here, white right here, right here, right here. The white spots can break down into cavities if the teeth are not brushed regularly and effectively. Now, I want to talk about these white spots, and here's that cavity right here. The tip. Let's see what's that. Go ahead, next slide. Okay, so here's a better slide. Here's the cavity. Right around it, you've got the white spots breaking down into cavities here. Here's a cavity with the white spot. More white spots, cavities. So what is a white spot? So in the winter, we're almost done with winter, but our lakes get frozen. And but if you have fish in that lake, do they die? Do the fish die in the lake? Anybody?
No.
No? Why not?
They go down.
They go down. What happens? The lake doesn't get frozen? There's what? Okay, exactly. So there's water under there, right? But the top layer is frozen, okay? So that's exactly what these white spots are. This is that top layer of ice, okay? And this is that water under it. That's that softer layer under it. And if you increase, if it keeps on going, that there's more water and that top layer is thin ice, boom, it's going to break, and this is what you're going to see. And that's what the white spot really is. So here's more examples. This is classic. Here, you see this yellowing here? That yellowing is not yellowing of teeth. If you were to take that Explorer and scrape it, it's going to be plaque. And if you scrape it, guess what you're going to see? You're going to see this white layers right there. And then this is when it all breaks down. So this is, these are all baby teeth. This is a little kiddo. I mean, I don't know how old this kid is. I can't see back there, but I'm guessing about 3, 2, 3. Okay. Same thing, white spots, not the best slide here, white spot, cavity. We'll go to the next one. The reason this one's here, it's not so dramatic. It's like, well, she showed all these cavities. Why is she showing this tiny cavity? Because this is what I get a lot, that parents come here and they're like, my child was playing and I think my child fell down because there's this little chip on their tooth. It wasn't there yesterday. It's just there today. I swear it wasn't there yesterday. It was just a chip. And then they're like, okay, we'll see them, what happened? And then you look at this and you tell them it's a cavity and they're like, what? That can't be a cavity. But what has happened is this has been growing. Well, maybe they did fall down and it was that thin layer of ice, boom, and it's just gotten really bad overnight. But this is a cavity. This is not from falling and breaking a tooth, because otherwise you wouldn't see this layer of white and all of that. Okay, so I like this picture because of this apple core, eaten up from between. The reason this happened is because, as you'll see right here, these teeth are touching right here. And I'm willing to bet money that these teeth were touching too. So this tooth, like this tooth right here, should have been about this big. And this tooth should have been about this big. And they were all touching right here with all teeth. It's called floss. Now that's kind of the hardest thing, because people go, well, do you floss babies' teeth? And the answer is actually yes. Even if, this is a great slide, because look at this. There's space. Look at all the space between this tooth and this tooth. Or even here, I mean, you can't see it, but there's space between these two teeth. So does a mom really need to floss here? Because you can really get a toothbrush and brush those areas between the teeth. But I always say go ahead and floss, because even if the teeth are not touching, when your child gets older, when your child's a teenager, I guarantee you their teeth are going to be touching, and flossing is going to become a major issue at that point. And so might as well build a good habit early on. So this is the example of a whole bunch of things: juices, not flossing, not brushing, all kinds of stuff.